Happy St. Patrick's Day. I got my green vest on, and it is like 20 degrees here in Ohio with snow on the ground. Mind you, it was just 70 degrees back to back days a couple days ago in the middle of March. So, March is always a roller coaster ride, but we won't get into that. Let's talk about Medicare. Exciting topic. I know you're dying to learn about Medicare. Medicare can be one of those topics that you don't really care about until you're about to enroll or use it. And if you're approaching retirement, there's a good chance Medicare is somewhere on your radar. And when people start looking into it, they usually have the same reaction. Wait, I thought Medicare was free. Maybe not, but some people think Medicare is free, and I think it can get confused quickly and easily with Medicaid, and Medicaid is something completely different. But today we're going to talk about Medicare. Well, if you've ever looked into Medicare, you might start seeing there's a Part A, a Part B, a Part C, a Part D, Medicare Advantage, Medigap, premiums, penalties, you name it. It can get overwhelming pretty quick. Of course, I want to slow this down and talk through these Medicare decisions because sometimes they can cost people thousands of dollars if they're not careful. But before we get into these decisions or these top 3 things to be aware of, I think it helps to understand what Medicare actually is and how it was built. I'm just a big believer that if you understand the foundation first, the rest of the system and how it works becomes much easier to understand. So let's start there. What is Medicare? Well, Medicare became law in 1965 under the leadership of Lyndon B. Johnson. It was created because many older Americans had a very hard time getting health insurance once they stopped working. Before later insurance reforms, like today in the Affordable Care Act, which now guarantees approval, insurers could literally deny coverage or charge way higher prices based on age or health status. So once people retired and lost their employer coverage, many people just simply couldn't get affordable health coverage anymore. So the government created Medicare as a federal health insurance program, primarily for people age 65 and older, along with some younger people with certain disabilities or conditions. And today it covers more than 65 million people. And similar to Social Security, it's funded primarily through payroll tax in your working years. And on most paychecks, you'll see something called FICA tax. So Medicare really doesn't just appear at age 65. Many people have been paying toward the system their entire working life. And it can get confusing because if someone says, all right, I'm going to go on Medicare, it sounds like one simple plan. But of course, it's never one simple plan. Instead, Medicare is made up of several different parts. There are technically 4 parts to Medicare. Technically 4 parts. But I think the easiest way to understand the system is to start with the foundation. And the foundation, and really just the first 2 parts, Part A and Part B. And together, those 2 pieces are really what people usually mean when they say original Medicare. Everything else builds on top of that. And maybe this isn't the best example, but I think it works. Think of Part A and Part B like the bun and the patty of a burger. And the rest are condiments. And trust me, condiments matter just as much. Choosing the right ones matter just as much, and people have their preferences. Let's walk through this. First up, Part A, which is called hospital coverage. And Part A is primarily hospital insurance. And what does that really mean? Well, it helps cover things like hospital stays, skilled nursing care, home health care, hospice care. And most people don't pay a monthly premium for Part A because they paid Medicare taxes while working. So Part A, hospital coverage. I think an easy way to remember this is admitted to a hospital or a facility. For example, if someone has a fall, breaks their hip, and is admitted to the hospital for surgery and recovery, that situation mostly falls into the Part A bucket. Now let's move to Part B, medical coverage. And you can see how this is confusing already. You have hospital coverage and you have medical coverage. But Part B covers doctor and outpatient medical care. Things we're normally familiar with, things like doctor visits, specialists, lab work, x-rays and MRIs, preventative screenings, physical therapy. If Part A is on the hospital side, Part B is that doctor and outpatient side of Medicare. And Part B does have a monthly premium. Now we're going to skip ahead a little bit to Part D, which is prescription drug coverage. This part was actually added later in 2003, so it's fairly new because prescription medications had become a much larger part of healthcare spending. So medications for things like blood pressure, cholesterol, diabetes, and many others are typically covered through Part D plans. So, in our burger analogy, this is like cheese on the burger, which is a pretty important topping or condiment. Now, someone might ask, why wouldn't everyone just add Part D? Some retirees have credible drug coverage through a retiree health plan, VA coverage, TRICARE, or certain employer plans. And in those cases, you just may not need a separate Part D plan. But I think it's important to note that, let's say someone doesn't have any other qualifying drug coverage and they delay enrolling in Part D, and they later on, years later, say, oh, wait, I want to enroll in Part D coverage now. Well, Medicare can apply a late enrollment penalty at that time. And the reason for that is pretty simple. Medicare doesn't want people skipping drug coverage for years and years and then only joining the system once they suddenly need expensive medications. So delaying Part D without other coverage can make the plan permanently more expensive later. So it's one of those decisions that I think is worth thinking through carefully. So we talked about Part A, and we talked about Part B, and we talked about Part D. We have hospital coverage, medical coverage, prescription drug coverage. Part C is coming, I promise. But I want to talk about something called Medigap. Now, original Medicare Part A and Part B doesn't cover everything. There are still deductibles and coinsurance. And if you want, you can add something called Medigap. Medigap policies are private insurance plans that help cover some of those remaining costs, like deductibles and coinsurance. They sit on top of original Medicare. So this could be onion, lettuce, or tomato. Take your pick. But it helps fill in some of the gaps, which is where the name comes from, Medigap. And some retirees like Medigap because it creates more predictable medical costs. But I think Medigap is more like an onion. It's definitely a preference call and not on every burger. And it's important to understand that Medigap is totally optional. All right, now back to the one we skipped earlier, Part C. And this is also known as Medicare Advantage. Now we have all these different condiments or toppings, and Medicare also created an option where you can just order the whole burger already assembled. Instead of using Medicare Part A, Medicare Part B, and then adding things like Medigap or Part D, some people choose a private insurance plan that administers their Medicare benefits. And these plans often bundle coverage together and frequently include all these parts and the prescription coverage as well. Many Medicare Advantage plans advertise lower monthly premiums, extra benefits like dental or vision, and it's all in one bundled plan. So whether it's a burger or a combo meal, take your pick. But of course, they may also involve provider networks, prior authorizations, and different out of pocket structures. Now, today, more than half of Medicare beneficiaries are enrolled in Medicare Advantage plans. So, quite a few people like them. And that doesn't automatically make it the best choice for everyone. It just simply shows that people like the bundled structure. I mean, there's a reason why we order combos and not everything separately. So, to recap, the bun and patty are Part A, that hospital coverage, that inpatient stay, and Part B, the medical coverage, that basic doctor visits and x rays and lab work. Those are required. That's the foundation of Medicare. Everything else is optional toppings. Now, I will say, I think most people enroll in Part D, but I think you get the point. There isn't one universal answer. And understanding the structure can help you make better decisions. And let's get into those decisions and look at the top three where some costly mistakes can happen. Now, one of the most annoying Medicare surprises, maybe for some, is learning that some people pay more for Medicare based on income. And this mainly affects Part B and Part D premiums. And the rule is called IRMAA, IRMAA. And yes, this industry is just addicted to acronyms. IRMAA stands for Income Related Monthly Adjustment Amount. So yeah, it's a mouthful. I think an acronym is warranted here. I'll say it again, Income Related Monthly Adjustment Amount. And what it means is this: if your income is high enough, Medicare says, well, your premiums are going to cost more. And the look back is 2 years. So they look back 2 years at your tax return. So your Medicare premiums in 2026 will usually be based off of your 2024 income, which I think is good to know because income often changes quite a bit right around retirement. I mean, really, the final working years can sometimes be the highest income years of someone's life. Or maybe someone receives a large bonus or payout or distribution. Maybe they sell their business because they're about to be retired. Maybe they sell an investment property because they're about to be retired. or they might do a large Roth conversion. And those decisions can make sense financially. But if they happen too close to Medicare eligibility, those 2 years, they can temporarily push income high enough that Medicare premiums increase a couple years later. Now, to be clear, this shouldn't steer away from those financial decisions just based off of Medicare premiums, because it normally doesn't make or break someone's retirement plan. But it could be an unpleasant surprise you didn't see coming. And the reason Medicare does this is pretty straightforward. Higher income households are expected to pay a larger share of the program's cost, while lower income retirees pay less. So understanding the timing can just help make more informed decisions, or at the very least, just know it's coming. Unexpected costs always feel worse than expected ones. It's kind of like thinking a drive will take 30 minutes and suddenly it takes an hour. But if you knew ahead of time it was going to take an hour, well, then it feels like an hour. It wouldn't feel nearly as frustrating. Now, the next decision is how you want your Medicare coverage structured. And at the most basic level, you're deciding how much of your healthcare costs you want to insure away and how much you're comfortable covering yourself. As I mentioned, some retirees simply use original Medicare, which is just Part A and Part B, the original parts established in 1965, and then pay certain deductibles or coinsurance themselves, while also maybe adding Part D for prescription coverage. And some also choose that Medigap coverage, which helps reduce many of the deductibles and coinsurance costs that come with original Medicare, Part A and Part B. And people who choose Medigap often like predictable medical costs. Another path is the Medicare Advantage plans, which quite a few people like. I think it's really helpful to know this before you enroll, instead of just picking what you think is best, but coming from a place of confidence and an educated decision. Because an important detail to understand is that when you first enroll in Medicare around age 65, you typically have guaranteed access to everything. And later on, switching options can sometimes become more complicated depending on the state and the policy. So understanding how these structures work early can just help you make that more informed decision. And last but not least, Part B, enrollment timing. We haven't really talked about the enrollment timing quite yet, except for age 65. And when you turn 65, Medicare gives you an initial enrollment window. It begins 3 months before your birthday month, includes your birthday month, and then continues 3 months later. So it's really a 7-month window to enroll in Medicare. And during that time, many people enroll in Part A and Part B. But there's an important exception. If you're still working and covered by an employer health insurance plan, you can often delay Part B without penalty. Many people will still enroll in Part A even if they're still working, since it usually doesn't have a monthly premium if you've worked long enough. But they delay Part B since they already have coverage through work. But yes, there are penalties if you don't enroll or don't enroll in time. And there is one situation where people can sometimes delay Part A as well, and that involves health savings accounts. Once you enroll in any part of Medicare, you are no longer able to contribute to an HSA. So if someone is still working and they want to continue maxing out their HSA before retirement, which can be a smart strategy, well, they would delay enrolling in Part A and Part B, because if they did enroll, it would stop. They would not be able to contribute to the HSA anymore. So some people might delay until they fully retire. But the key detail is that the coverage must be active employer coverage. That is like the exception to not enrolling. COBRA does not count the same way. Marketplace plans usually do not count the same way. But as I mentioned, if someone delays enrollment when they shouldn't have, when they don't have an active employer plan in place, Medicare applies a penalty. Now, it's not the worst penalty in the world, but your Part B premium increases 10% for every year you delay enrollment. And here's the thing, that higher premium sticks around for as long as you have Part B. And for most people, that's for life. So there you have it. Now you know quite a bit about Medicare, what it entails, what it involves, and some of the things to think about prior to enrolling. And it's not all that scary. I think even I'm making it sound a little bit like, whoa, it's not that bad. But it is important that you get them right. Things stack, and if you can get the easy things right, you'll just feel better about it. Medicare was created to provide healthcare security in retirement, and for millions of Americans, it has done just that. But like, I don't know, every government program or system, the rules can feel confusing until you step back and just see how the pieces fit together. And that clarity is what good financial planning is all about.